yesterday, the more we test, the higher the number of positive cases that we are likely to get. Today, 147 people have tested positive out of 2,831 samples now tested. This means that Kenya now has 1,618 people who have now tested positive. The cumulative test conducted so far is 70,172. And in terms of age distribution, the youngest is a 1-year-old infant, while the oldest is 87. These cases are spread across the country, 90 in Nairobi, 41 in Mombasa, Kiambu has another 3, and so on and so forth. We have also got now counties that have got cases that didn't have before. Nyeri has joined with 2, Uasin Gishu has 2, while Kajiado, Kilifi, Embu, Homa Bay, Murang'a, and Machakos all have at least 1 each. So out of the 147 cases that I mentioned, all of them are actually Kenyans. We don't have any foreigners out of them. 87 of them are men, while 60 of them are women. Men continue to get to positive cases in much, much larger numbers than women. But even with rising numbers, I'm also glad to inform you that today we have discharged 13 patients who have recovered from the disease, and we are always happy to hear that. So our total number of recoveries now stands at 421. On a sad note, however, we have lost 3 people from the disease. 1 of them in Kiambu County, in Thika, and 2 others in Mombasa. Both of the cases in Mombasa had underlying conditions. I want to pass my sincere condolences to the families and friends of the departed. May their souls rest in eternal peace. As I conclude, facilities is to ensure that our people remain healthy and remain in a situation, in a condition where they can be contributors to the economy rather than sick individuals. So this is the main objective of the universal health coverage is essentially that, is to keep our population healthy. And I want to say that we will be enhancing our UHC capacity. We will be building on UHC. We will be launching it everywhere. We are building the institutions that are necessary to make UHC possible. Those institutions include the National Hospital Insurance Fund, KEMSA, as well as other national organizations that are critical in the support for UHC. We have learned that there is need to strengthen primary health care at the community units, dispensaries, and health centers. And as you know, most of these are devolved functions. So we are quite glad, especially in Kiambu, about what you have done with primary health facilities. We continue to insist that the best cure for disease is prevention. If we can be able to prevent people from getting sick, and some of the measures that we have seen, hygiene measures that have been taken at county level, have contributed to reducing the incidences of disease across the country. And we would like to urge that some of these measures that we take, or we are taking because of COVID-19, should be sustained and maintained into the future so that they can be part of our way of life. Washing our hands, sanitizing ourselves. This is something that we should continue with, even post-COVID.